So we are talking about methods of contraception and contraceptive methods. So the next method of contraception is intrauterine devices. These are the devices which are inserted by the doctors or expert nurses in the uterus of the female through vagina. These are long acting and also reversible contraceptive methods. So whenever couple needs to stop this contraception, they can stop it. So if the female can even conceive, so these are called reversible contraceptives. We have three different methods of reversible contraception which are available. First, number one, this is non-medicated. Generally, non-medicated contraceptive or IUD is generally the devices are made of either plastic or stainless steel. The best example for this is Lippes loop. Lippes loop is made of plastic, and this is made of plastic and is impregnated with barium sulfate. Now the question is, how exactly Lippes loop work? Lippes loop attract the macrophages. So all the macrophages will get concentrated in the uterine cavity. So these macrophages acts as spermicidal agents. The spermicidal agent it acts as. So they kill the spermatozoa by process called phagocytosis. So there is no chemical used here. It just works on the technique of phagocytosis. Next, copper releasing IUDs. So this copper releasing IUDs release copper. So let us find out some historical background for this. For the very first time, Grafenberg is a scientist who actually coated the copper compounds on a silver wire, and this was introduced into the uterus. It worked as a contraceptive. Next, later on, nowadays, after 1970s, where the plastic is coated with copper compounds and those are inserted into the uterus. So they will release copper ions slowly. So this includes, we have some examples of these copper releasing IUDs, which includes CUT, CU7 and Multiload 375. These are the copper releasing IUDs. How exactly they work? What is the function of these copper releasing IUDs? Copper releasing IUDs release copper ions. These copper ions suppress the mitochondrial activity of the spermatozoa, so that the mitochondrial activity, when it is suppressed, the flagellar movement of the sperm is completely suppressed. As a result, motility of the sperm will decrease. So this is how this copper releasing IUDs work. Copper releasing IUDs, what is their function? They reduce the motility of the sperm. Reduce motility of sperm. Sperm motility will be reduced by copper releasing IUDs. So what is their action? Their action is that they go and suppress the mitochondrial activity so that the flagellar movement of the spermatozoa is prevented or it is suppressed. Next, and copper releasing IUDs can also be used as emergency contraceptives. Next, hormone releasing IUDs. These hormone releasing IUDs are principally composed of, or the chemical that is present in this is Progestasert and LNG20. This is called as levonorgestrel 20. This is a hormone releasing IUD which contain progesterone. So progesterone based are these hormone releasing IUDs. What is their function? How do they work? Now these hormone releasing IUDs will completely change the cervical mucus. So this cervical mucus, they will increase. So complete cervix becomes clumsy. It is cloudy with mucus. So sperms get trapped in the mucus. Sperm puts lot of its energy to get out of it, but sperm cannot do that, and the sperms will die in the particular mucus and they get trapped. So this is how this contraceptive works. Next, another interesting feature is this hormone releasing IUDs also change the endometrium. So how do they change the endometrium? In general, endometrium, if it thickens, that thickened endometrium helps in implantation, whereas hormone releasing IUDs will cause changes in the endometrial lining so that the endometrium becomes very thin, so that they will alter the endometrium so that implantation does not occur if by chance fertilization occurs. So this is how hormone releasing IUDs work. So hormone releasing IUDs work by increasing the cervical mucus, by where the sperm can be trapped. Next, they will alter the endometrial wall so that implantation do not occur, right? So IUDs are most widely used contraceptives in India, and IUDs are preferred for those couple or a female who need to delay their pregnancy, and also used for those couple who need space between children. So these are the most commonly used contraceptives in our country, intrauterine devices. Next, we have the other method which is called oral contraceptives. What are these oral contraceptives? Oral contraceptives are consisting of like administration, oral administration of either progesterone or progesterone estrogen based. We call them as combined form. Progesterone estrogen based tablets, which are commonly called as pills. We call them as birth control pills. These birth control pills are of different types and they work in different fashion, but basic mechanism or physiology is same. So let us find out what are these different types. First, we are calling this as daily pills. So what are daily pills? Daily pills are those oral contraceptive pills which are taken for a period of 21 days. So during the menstrual cycle of 28 days, these pills have to be taken for 21 days. So starting from the first 5 days of menstrual cycle, these would be taken, and then there is a gap. Gap means there is a relaxation period of 7 days gap. After that, again there is a repetition of these pills. So what is the standard duration or a standard timing for these pills? How exactly these pills work? Say for example, this is your menstrual cycle, which is from day 1 to day 28. So this is day 21, right? 21st day. These are 28 days of menstrual cycle. The pills have to be started from day 1 till 21 days. Actually, the pills pack contains 28 pills. Out of these, the 21 pills are called active pills, and these active pills contain either progesterone or progesterone estrogen combinations. We call them as combined pills, right? So the 21 active pills, and then the remaining 7 pills are inactive pills. So 7 pills are inactive pills. So these are nothing but sugar coated pills. That is to maintain the continuity. So we are going to take all the 28 days, the pills have to be taken, but 21 days the pills are active, which are loaded with hormones. So this is how the daily pills work. Fine. Next, if someone do not have a time to take pill on every day, right? So we have one more option which is called weekly ones. So weekly pills. So the best example for this weekly pill is Saheli. Guys, remember there was a question asked on this many times in your Neet. Many times there was a question asked on this. So let us find out few characters of this Saheli. Saheli is actually a weekly once a pill. First 3 months when the pill is started, it is twice a week, and after that weekly once the pill has to be taken. Now this Saheli is a contraceptive pill which was prepared by CDRI Central Drug Research Institute. This is actually non-steroidal pill. So the meaning of this non-steroidal pill is it has no side effects or generally less side effects, and it has a chemical which is known as centchroman. Centchroman is the chemical that is present in the particular pill called Saheli, which is prepared by CDRI Lucknow, which is a non-steroidal pill, weekly once pill. Fine. Now what is the function of these particular centchroman or the Saheli, how it works? Generally there are estrogen receptors present in the uterus. So the centchroman block the estrogen receptors in the uterus. When estrogen receptors are in the uterus are blocked, uterus cannot respond to the estrogen. As a result of that, because what is the role of the estrogen? Estrogen is responsible for proliferation of the endometrial wall and thickening of endometrial wall. It prepares the uterus for implantation to occur. So Saheli prevent implantation. Guys, remember this point, it prevents implantation. Implantation is prevented by Saheli. So I can say that Saheli work as anti-estrogenic pill, right? It go and block the estrogen receptors, so I can call it as anti-estrogenic pill. So these are the weekly pills, these are daily pills, and these are containing either progesterone or progesterone estrogen combinations. We call them as combined pills. Next, apart from this, we have injectable contraceptives. So what are these injectable contraceptives? Either a progesterone or in combination with estrogen combined, right? So can be used by females as injections, right? So the most common example for this injectable is DMPA. This is called depomedroxyprogesterone acetate injections, or this is also known as Depo shot. This is commonly called as Depo shot. Depo-Provera is the name of this. This is called as Depo shot, so known as. Now this works for almost all 3 months. So when once a progesterone injection or a Depo shot is taken, it works as a contraceptive for almost all 3 months. And also we have one more method which is called implants. What are implants? These are nothing but consisting of flexible plastic rod which is about the size of a matchstick that is placed under the skin just in the upper arm, right? Because it is covered, so that is the reason why it is placed below the upper arm. So it releases progestin. It releases progestin, right? So an example for this is Norplant, and there are 6 matchsticks will be there. I mean matchstick sized progestin compounds, progestin loaded sticks will be there. They are inserted below the arm in the form of fan shaped. Just by a small incision is made, there is no surgery is required, they will insert. Whenever someone wants to take out this, just by with the small incision on the skin, they can be taken out easily. And this method of contraception work for 3 to 5 years. It works for almost all 3 to 5 years. So this is for daily, this is weekly ones. When once someone take injectables, they work for almost all 3 months, and implants will work for 3 to 5 years. This is how this contraception works. Next, emergency contraception. Emergency contraception is used to avoid an unwanted pregnancy, which is a normal unprotected sexual intercourse, or in case of any sexual assault, what do you call rape. So to avoid that pregnancy, we use emergency contraception. How exactly this is done? Emergency contraception, here also we go for administration of either progesterone only or progesterone estrogen combinations or IUDs, especially copper IUDs are used here, right? So this is how this emergency contraception is done. Now in this emergency contraception, most commonly used contraceptive pill is mifepristone. Mifepristone is most commonly used emergency contraception, which is known as RU486, right? So what exactly the role of these? If such like emergency contraception is used, especially like when we are using copper IUDs as an emergency contraception, which are commonly used, IUDs, copper IUDs are used. So this will prevent like the sperm motility. So this is one method. The second thing is that if already sperm has reached, this has to be taken within 72 hours of unprotected sexual intercourse, right? So if suppose if already the sperm is reached, then what we have to do? So then this will prevent fertilization. So this emergency contraception delay ovulation process. As a result of that, fertilization does not occur, and this works as a contraceptive technique, right? Next, all these methods up to this what we have discussed, and all these are reversible. So whenever couple need to pause this contraception, they can do it, and where the female can conceive after stopping this contraception. Next, we have a last method which is called surgical method or sterilization technique. So here these are the terminal methods which prevent any more pregnancies. So this is a completely terminal method. Reversibility is not there here, very less chances. We call it as terminal methods. If the couple wanted to stop the pregnancy or stop giving birth to children, then they can go for these. This includes vasectomy. Vasectomy is done to the male. A small part of vas deferens is removed, or it is removed and it is cut or tied up through a small incision on the scrotum. That's it. There is no big kind of a surgery will be done here. Next, tubectomy is done to the female, where the fallopian tube is removed or it is tied up through a small incision that is made in the abdomen or through vagina. So this is the surgical methods or terminal method of contraception, which is called sterilization. And one more point, what you have to remember here is emergency contraception do not provide any protection against STDs. The only contraceptive method that give protection against STDs is your barrier, that too condoms in male and female condoms only, right? In female there are some other barriers we have discussed, like cervical caps, vault caps. They do not provide protection against STDs. Only condoms in male and female can only give protection against STDs. Remaining other contraceptions, they do not provide protection against STDs. Guys, hope you all understood the lecture. Please give a like. If you are new to the channel, hit the subscribe button. Good luck.